we applied for funding through GET as we had developed a research question that was very focused on dietetics, and this was to improve the way we measure fluid and beverage intake in free living adults. And this was something that maybe wouldn't be a priority for other funders, but we felt this was really important for dietetics. So the GET fund allows researchers to apply for funding in areas that maybe wouldn't be funded elsewhere. And also it provides a reasonable size of fund as well, so that can be used to run a pilot project, to develop data and pilot data to take forward for future research funding. The research was to develop and evaluate a fluid and beverage intake measurement tool to be used in UK free living adults. And we used the funding primarily to fund a research assistant who conducted a systematic review, practitioner survey, and then ran the evaluation study. It also did cover the costs of some consumables that we needed for the evaluation study. So the grant really helped with the project as it allowed us to have resources on the research side to conduct a systematic review and also an evaluation study. So those are very kind of labour intense projects, and it was essential to have that funding available. In terms of publications from the research, we've published the systematic review and also the evaluation study. In terms of helping practitioners working in workplace health and also in other public health settings, we have developed a tool that we are happy to share with other researchers and practitioners that can be developed to collect beverage and fluid intake in various settings. So in terms of accessing the research, they are both published open access in Journal of Human Nutrition and Dietetics. In terms of the tool, then if researchers or practitioners want to contact the research team directly, we would be able to provide details of the measurement tool. If you're thinking about applying for GET funding, I would definitely think about the research question, have a very clear idea of the research gap and what you want to do to fill that gap. I think planning is also important as well, so in terms of how long it takes to write an application and things like kind of putting the resources plan together, so it's not just the time but also how much money is required to do each part of the project. The top three things I would say if you're planning to apply to the GET fund is to think about resources, so really thinking about what can be achieved in a time frame and what resources you're going to need, and this is staff and consumables, and just be realistic as well. Nothing worse than kind of over-promising and then realising you're going to run out of time or funds without completing the project. The second thing I would say is a clear research question, and I think this needs to be communicated in a very clear way to the panel. And the last area I would say is really look at what's out there at the moment, so really checking the evidence base. So this can be looking at the PEN resource and also clinical trials registers to really get an idea of what research has already been done in the area. I found the process very straightforward in terms of the application form that needed to be completed and the information that was required to complete the form, and in terms of submission to trustees and getting feedback from the trustees, that was all very well communicated throughout the process. And in terms of receiving the funding, again, there was very good communication in terms of what was required to activate the funding, and also the progress reports were very helpful to kind of keeping you on track. So the work of GET is important for dietetics because nutritional funding is very competitive, and a lot of the funding available is through kind of more traditional health research funders. So it's really important that dietitians can research in areas that are important to the dietetic profession, which may or may not be funded by other funding bodies. It also then puts dietitians in a really good position to develop skills in terms of publication record and running a grant. That then puts them in a good position to go forward to apply for larger pots of funding and further research careers. And it's really important to encourage dietitians to try to see research as a credible career option. alongside kind of other careers that are available. So I think the GET funding is essential in terms of developing the evidence base, but also developing future dietetic researchers.